So, Manny, let's look at why we sleep. I know that there's a lot of discussions about this. The first reason why we do this is basically to survive. What it does is it shows that a consistent lack of sleep really affects our immune system negatively, and we lose focus and we have difficulty completing everyday tasks unless we sleep. And that is because the sleep actually affects our nervous system. Tell me a little bit about that, Manny.
Absolutely. So our nervous system kind of acts as our electronic highway throughout our body, which is controlled by the ECS, the endocannabinoid system, which we'll get into further. And the way I like to describe it is as the picture suggests, do not disturb while sleeping. Your body's rebooting. You're having hopefully some good REM sleep and your neurons are getting some rest. You're reconnecting some synapses. Your immune system's boosting, so your body's healing more efficiently and better. And this is why it's so important to get that sleep, so that way our body can basically have a nice reboot and be ready for the next day.
And more importantly, it helps us grow and it also helps us heal, which is really, really important. Deep sleep helps release that hormones that are important, not only for children, young adults, but also people that have injury. So what's interesting is that Sleep Association has found out that 1 out of 3 people suffer from insomnia. This is important because a lot of people who have trouble sleeping think they're alone. They really aren't. They're part of a larger society. But mainly there's also a byproduct of this, and that is that a lot of people that have trouble sleeping have trouble with pain and anxiety. And that's the main reason why people are having trouble sleeping, which is what cannabis does a great job of addressing. Now, let's talk a little bit about the sleep duration and the quality of sleep. I know that we take a look at, based on our age, it's important to have some certain areas of recommended of sleep, but really over the age of 18, 7 to 9 hours of sleep is really important for us to get. Our immune system, it really uses that time to really take those neurons, help you to be able to recharge them for your immune system. Sleep helps you also to your body conserve its energy and to restore the immune system, really refresh itself. And it does that by generating what they call cytokines. And these are chemicals in our immune system that help us fight infection and also are very powerful sleep inducing chemicals. But Manny, there's also some disorders, some physical and mental disorders that can really pop up if we don't get the right amount of sleep.
Absolutely. The lack of quality sleep, continuous sleep of 7 to 9 hours, not that broken sleep, can lead to negative symptoms such as anxiety, stroke, cancer, schizophrenia, and depression. And even though our bodies are so resilient and you may adapt to having less sleep or broken up sleep, doesn't necessarily mean it's good for you. You're still getting more wear and tear on your mind and on your central nervous system throughout your body that can actually have an impact on your health.
Right. And it's important to understand, we all want to sleep, but these are some of the, and if we have trouble sleeping, these are some of the disorders that we run into by not getting enough sleep. So let's dive into basically how do we get better sleep. I know that one of the reasons for using cannabinoids is the entourage effect, but Manny, tell me a little bit about what cannabis is, because cannabis is broken down into a number of different components like cannabinoids, terpenes, and flavonoids, right?
Absolutely correct, Mark. And so basically you have different routes of administration, different products and so forth, but the main goal is to actually achieve the entourage effect and or the synergistic effect. And basically what that is combining your cannabinoids such as THC and CBD with specific terpenes that are grown naturally to that specific strain or cultivar with the specific flavonoids all mixed in together to give you that perfect effect or that entourage effect. And the best way I like to describe it is like going out for a bowl of spaghetti and meatballs. You have your THC, which is your pasta, your CBD, which is your meatballs. By themselves, they'll sustain you, they'll feed you, they'll do what you need them to do. But if you add that perfect red sauce marinara or that perfect white vodka sauce with your condiments on top of that, Parmesan, salt, pepper, and so forth, now it's more palatable. But that is specific per person. And that's how cannabis is. It's very specific.
And working together, they really enhance the medical benefits. And that's what one of the real keys to cannabis is your body knows what it really needs, and it really provides the medicine that it needs. The question becomes, how does your body know? And this is where something called the endocannabinoid system comes into place. Now, we didn't know about the endocannabinoid system for many years, and it wasn't until we started studying cannabis that we found out what it was. Then we found out how important it is. Tell me a little bit about this, because this is something that has really allowed us to make some major medical breakthroughs and understand how we can really help our body stay in homeostasis, which is stay in balance.
100% right, Mark. This is one of the particular subjects that we could talk on forever about, but basically to put it in the best nutshell I can, the endocannabinoid system directs physiological processes affecting pain, appetite, anti-inflammatory effects, and it does it through the main 2 components or receptors are CB1 and CB2 receptors. There are many other receptors that we're still learning about, but these are the ones that we are basing our products or our decisions of purchasing products off of. And basically CB1 is your main receptors found throughout the spinal cord and the brain. And that's what THC directly correlates with more prominently, whereas the CB2 receptors are more in your peripherals, your arms, your legs, your gut, your feet, your hands. And that's what CBD really binds to really well, although they do cross from time to time. And being able to use this endocannabinoid system that regulates our central nervous system, our digestive system, our cardio system, helps us balance out the homeostasis using cannabis as a supplement rather than synthetics.
Now, if we take a look at why the endocannabinoid system works, it's really fascinating because our body knows that we have a problem. If once your brain says, Houston, we have a problem, what it does is it produces endocannabinoids, and it sends those endocannabinoids to that part of your body to address the pain, the inflammation, whatever problem that we're trying to address. But as we get older, or if we have some sort of an injury, our body doesn't have enough endocannabinoids to be able to be produced by the body to be able to address your particular condition. And that's where what's called phytocannabinoids come into play. Interestingly enough, the cannabis plant produces phytocannabinoids that actually mimic the endocannabinoids in our body. Tell me a little bit about that.
I'd be happy to. So our body has a natural internal pharmacy, if you will, that produces these endocannabinoids, such as anandamide, which correlates with THC, or 2-AG, which correlates with CBD, which we get phytocannabinoids from the marijuana plant. So when you're taking these, as we mentioned before, these are like taking supplements naturally ready for the body to intake and then release if or when necessary. And then that's why there's no byproducts, there's no after effects, there's no withdrawal effects and so forth, because it's very natural to the body.
It's fascinating that really we're using our own natural components to be able to heal ourselves. I think that's one of the miracles of cannabis. And the question is that true? And there's been a substantial amount of literature out there that shows that the endocannabinoid system plays a major role in the circadian rhythms of our body, particularly our sleep and our wake cycles. Manny, look at the different studies that are out there about THC and CBD.
Oh, 100%. And this is a great balancing act to show that each one of us are different, just like our dreams are different if or when we do get sleep. Taking a product in order to regulate or help self-regulate our endocannabinoid system is so important when you're trying to do the same thing with sleep. THC has been shown to provide sedative properties, typically, especially actually if it's by itself. And CBD has the same effect in high doses if taken by itself. But we always want to remember that if you're using products, especially in the medical marijuana area, as far as Florida is concerned, you're getting products that are going to be both CBD, THC, and terpenes and flavonoids to get that entourage effect.
And the real key to cannabis is not just the cannabinoids, but it's also the terpenes. We'll talk a little bit more about that in just a few moments. But really, if you get the right mixture of terpenes, then you've really found the formula that you need to get sleep. Before we jump into that, it's interesting that some studies that have been done found that 67% of the participants have improved sleep at 30 days, while 25% reported worse sleep using CBD, for example. That's kind of interesting, Manny.
It very much is. And I would go as far as to suggest that just like anything else, these numbers possibly would be higher if we had actually taken it and did it specifically per individual. The study would have to be blind in order to be accounted for and then second rate or reviewed. So you're always going to have those percentages, but those are still very, very impressive that 30 days afterwards, blind study using certain products of CBD for sleep and anxiety, improvement had occurred, whereas only 25% had worsened. And then 60 days, 56, good sleep, 27% reported worse sleep. If we had taken the time to actually mitigate whatever factors, that would have taken the study away, but it would have probably raised those numbers as far as good sleep.
Right. And it showed that, the anxiety symptoms were decreased and remained low during the whole study. Now, I should point out that cannabis, being a Schedule I drug here in the United States, is not allowed to be studied. This particular sleep study comes out of Israel. By the way, it's been backed up by a number of other studies that's been done in places like Canada to really show that sleep is really important, and CBD plays an important role in really helping you be able to get a good night's sleep. But really comes down to the terpene profile. So Manny, tell me a little bit about this, because this is critical. We need to talk a little bit about not only the terpene profile, but how you take it.
100%. So this is very important when it's coming to sleep, because for the most part, especially for myself, when I'm consulting with patients or consumers, I mentioned that if you're using something for sleep, especially if it's to keep you asleep, an ingestible or a sublingual is usually best, because it lasts longer within the system. However, when you do that, unless it's a sublingual, 9 times out of 10, terpenes are destroyed as soon as it hits the stomach acid, which is the byproduct, or not byproduct, but the product of the cannabinoids, usually high THC, which is typically going to be very sedative on its own.
Right.
If you're using an inhalant, such as a vape, or if you're smoking flower or even vaping flower, then you're going to want to find a product that's very high in myrcene and or linalool. Those are very sedative and very relaxing, especially combined. And some will tell you that terpenoline is actually an uplifting terpene. It is. However, with high THC products, it's actually very relaxing and sedative. If you were to find terpenoline in CBD, it would be uplifting because it's not THC. So all these little formulations play a huge, huge role. But typically, you're going to want to find myrcene and or linalool if you're looking for help with sleep in any product that you're using.
Sure. And I think it's important to pick, when we talk about a route of administration over here, we talk about how you use it. Really, you want to pick a form of using cannabis that you will use. I know some people don't like to inhale. Smoking and vaping is not up their alley, but they may want to take a look at using tinctures or sprays, capsules, edibles, that type of thing. A couple of key things here, tinctures, take between 15 minutes to 20 minutes to work, and they'll last 4 to 6 hours. The same thing with sprays, but edibles and capsules have a whole different profile where they could take a lot longer to use, right, Manny?
That's absolutely correct. And that's a great point you brought up. That's why consultations are very important, because if you're looking to just get help falling asleep, usually a tincture a vape would be great. If you're looking for help to stay asleep, the capsule or edible would be great because it can take 15 to 20 minutes to take effect. But typically, depending on your diet, your environment, or what you're doing, it could take up to 3 or 4 hours sometimes. And just by the time you think it's not going to work, you go to take another dose or quarter dose, that's when it starts kicking in. And now you have a little bit too much in your system. No need to panic. You'll just sleep a little bit longer. So set your alarm on extra loud.
Yeah. So when you're taking edibles, one of the things to be careful of is some of these edibles taste good and they really, you want to take more, really let an hour or 2 hours go by before you take another one. So you just don't get to a point where you're feeling uncomfortable. But the nice part about edibles, which is great, is they can last sometimes between 4 to 10 hours. So if you're looking at getting a good night's sleep all night long, this is actually a pretty good option.
The idea is if it takes a while to get in your system, such as an edible or capsule, slow in, slow out. If it gets into your system really fast, like a tincture or mainly like an inhalant, fast in, fast out, less duration time.
Sure. And like this is really important. So really the importance of this slide is choose a route of administration that will really affect you. Are you looking for help relief immediately? Like for example, the topicals, transdermal patches, and flower. Are you looking for something that'll last 4 to 6 hours for the mornings or the afternoon, which is your tinctures and your sprays? Or are you looking for something to last longer than that, like for overnight to get some sleep, which is where your edibles come into play? That's where each of them has their particular role. And then if you can decide if you on a route of administration that you're comfortable with, then you can actually go, when you're at your dispensary, you can talk about the different terpenes that are there, and especially pay attention to the linalols and myrcenes and terpenolines. Is that a fairly good assessment, Manny?
I'd agree with that, Mark.
So let's talk a little bit about cultivars. So now that we know what terpenes to look for, you'll find these available in, now what's a cultivar? Cultivar is a combination of terpenes and cannabinoids and flavonoids that make up a particular product. When you walk into a store, you'll hear somebody say, I want to buy something, and they'll call the product Granddaddy Purple, which is made up of the myrcenes and the cannabinoids. Tell me a little bit about these different cultivars.
Absolutely, Mark. So cultivars, also known as strains, if you go into most areas, are exactly what you described, Mark. Is the whole terpenes, cannabinoids, flavonoids that make up that specific typicity of flower or product. As you can see here on the slide, you have Granddaddy Purple, Northern Lights, Blue Dream, OG Kush, Purple Kush. And a lot of these in themselves are becoming more and more iconic, if you will. There's so many names that pop out of there, and there's going to be different variations of Granddaddy Purple and OG Kush. What you want to pay specific attention to is the primary terpenes. And great demonstration on this particular slide is that all these particular cultivars have myrcene as their primary. Myrcene, very sedative, very relaxing. It's good on the whole body to help the body digress, and you're good. However, pay attention to the next one, especially on Granddaddy Purple. The next one is pinene, and that one is a very uplifting terpene for clarity, but The percentages are what make the difference. And the certain percentages in these will dictate how sleepy, how hungry, or excuse me, how relaxed, how digressed you will be. And if you also notice in the next one, the content, those THC percentages by today's ideas are not low, but they're moderate. Most people are looking for above that 20 percentile in THC. However, when you have a terpene such as myrcene as primary, that allows more THC to pass through the blood-brain barrier, hence more euphoric, more effect, if you will, and you get more relaxed. So you don't necessarily need to look for those high THC percentages. And then obviously you have the different flavors and aromas that come from the primary terpenes and the flavonoids as well.
And it's important to point out when we talk about the content, notice all of these are indicas and hybrids. Really, sativas don't come into play when you're looking at cultivars for sleep.
Absolutely. You're absolutely correct. Also, if you notice, the hybrids are not so much relaxed or sleepy. The hybrids are something else like creative and hungry. Those are going to be more like if you're mitigating your issues prior to going to sleep. And then if you couldn't, then you're going to use the berry blue or the granddaddy purple to kind of take you over that edge to get you to sleep.
Yeah. But I think the most important thing to point out is when you go into your dispensary is talk to them about the terpene profile. Once you get the terpene profile, they'll be able to then match the cultivars, because really there's a lot of different production of cannabis and a lot of different strains or cultivars. And your dispensary may call it something different or have a particular grow that they've done to really address your sleep issue. So it's important to talk to them. Manny, let's summarize what we've been talking about, because we went over a little bit about what cannabis is. We talked about how cannabis can help you. We've talked about a little bit about what products to use. Let's summarize this a little bit, but also tell me a little bit about the studies for medical cannabis.
So the studies that are out there, as you suggested earlier, Mark, are kind of scattered, and particularly outside of the US, which doesn't say that it's not worthy. However, in my personal experience in working in dispensaries and working with patients, studies have shown that medical marijuana can help improve sleep and lessen insomnia. It can lessen pain. It can help mitigate during the day before sleep. So if you're interested, follow us, do your studies, ask questions, find out what may most benefit you, and we'd be happy to help.
Sure. And the endocannabinoid system, we know, is really something that plays a major role in your circadian rhythm. Your sleep and wake cycle, that's really, really important. But I think, Manny, the last point that we want to make in summary is cannabis is safe.
100%. As it states there, according to the CDC, there have been no reported overdose deaths from cannabis, although even locally and in my experience, I've had patients who come to me saying that they had an overdose experience as declared by the emergency room for whichever hospital. And after asking questions, I figure out that that's quite not the case. It's more of underlying reasons that this occurred or whatever happened to them occurred.
Sure.
You can actually go low, very, very low. Go slow. There's products out there that will not have you euphoric or mess with your mental system, if you will, such as CBD, high CBD products. And then there's the high THC products, but you will not overdose. Quite impossible to overdose or consume the amount you need to overdose using medical marijuana.
Sure. And I think that's really, really important, because a lot of the pharma drugs that you take, you read the labels. One of the things it tells you is be careful because you could die. And I think this is where cannabis comes into play, and it's really a good alternative for a lot of folks. So I hope people will consider cannabis as an option to help them sleep. We've given you some formulas to do that and a way to talk to the doctors. Let's do a summary. Really, if you're looking for more information on just cannabis and how to use it, I recommend taking a look at our medical marijuana aware programs that we have out there. We have a YouTube channel that gives you a lot of videos on how to use, what to use at different conditions like sleep that you'll find in there, and also our webinars at Marijuana Aware. But also your website and your company is a resource as well, the Blunt Joint.
Absolutely. Thank you for that, Mark. So at the Blunt Joint, basically what we do is facilitate discussions per the client, whether it's a group or individual or a few people, and we give them insight, how to shop, where to shop, what to shop for, why you need to shop for these products based off of your diagnoses. We are not medical or legal professionals. However, we are subject matter experts, and all of our services are 100% free. All you got to do is reach out to us. The only thing I would like to leave in this particular discussion, considering sleep, is that if you're already using cannabis and you're starting to find less relief using edibles or ingestibles, try using something a little fatty, like a cup of yogurt or a spoon of peanut butter prior to using that product, and it may enhance it a little bit. But that's just a tidbit for this little particular particular segment that we're doing here.
It's perfect. And I should point out to everyone that we are going to have a number of other webinars this particular quarter. This week, we're talking about sleep. Next week, we're talking about pain, then followed up by neuropathy, PTS, arthritis, really the different cannabinoids, the power of the cannabinoids. I'll talk about how you personally use your personal cannabis treatment. And then also we're going to talk about cannabis use disorder this particular quarter. So please join us. And you can join us by RSVPing at Marijuana Aware. We want to thank everybody for joining us. And Manny, and more importantly, I want to thank you. Do you have any final comments?
Just always grateful for being a part of the show. Grateful for all the personnel that are joining or following up or coming in even after the fact. And again, please reach out if you're curious about cannabis. We're always eager to help.
Thank you. And thank you everybody for watching. Please like and subscribe to our YouTube channel. It really helps our channel be able to go forward, and join us next week for Pain and Relief.